Good evening, everybody, and welcome to our Womb Care Clinic webinar, where we'll be talking about cervical cancer. A very happy new year to everybody that has logged in, and I wish you all a prosperous and healthy 2026. Can somebody please confirm that my slides are visible?
They're visible.
All right. Thank you very much. As we all know, January is Cervical Cancer Awareness Month, and the burden of cervical cancer in Zambia is quite high. My name is Dr. Paul Mwembamsoba. I'm a consultant obstetrician and gynecologist. I'm also a fistula surgeon, and I'm a fertility fellow placed at Womb Care Clinic. And I'll be taking you through this quick but very important presentation on cervical cancer. Please note that this session is for learning and awareness purposes only. For personal care, please consult your healthcare provider. I always love this image that's on the screen right now because I think it speaks to a lot of diseases that actually affect a lot of women. And if you look at cervical cancer, this is a disease that affects women of different backgrounds. But in particular, it has been seen that the burden of the disease is much higher in sub-Saharan Africa and in third world countries, where Zambia actually falls in. So you ask yourself, what is the cervix? Because this is the primary area where cervical cancer actually develops. So the cervix is simply the narrow end of the uterus, or the womb as it's called. And as we all know, the womb is what houses the baby when a woman gets pregnant, and it is the area from which menstrual periods actually occur from. So now when it comes to the cervix, so the cervix is simply this narrow opening that helps transmit substances from the vaginal area, which is the outside, all the way into the uterus. So it's the connector that is there between the uterus and the vagina. It also acts as a passage and as a secretion gland where it secretes mucus on its own. So if you look at cervical cancer in particular, cancer to start with is simply an overgrowth of cells. So cells begin to grow abnormally, and once they begin to grow abnormally, you find that that is when people develop cancer. So any part of the body that has cells has got the ability to develop cancer. As we all know, human beings, when broken down to the smallest part that they are, they come down to a cell. So you find that our bodies have got the potential to have a dysregulation in the way cells get to develop and the way they get to die, and therefore somebody can end up developing cancer. So when we're talking about cervical cancer in particular, we're talking about this overgrowth of cells that is happening within the cervix. And this overgrowth of cells that is happening within the cervix leads to the cervical cancer itself. In Zambia, cervical cancer is the leading cancer amongst women. We'll look at some more facts even as we proceed. So, some facts about cervical cancer. Number one is that it is highly preventable. And we'll talk about the prevention measures that are available. And with the HPV vaccination and early screening, you find that cancer can be prevented and it can also be treated whilst it's in early stages. So with screening, early detection, cervical cancer is 100% curable. If you look at the global burden, and this is according to the global cancer statistics, you find that the incidence of cancer as of 2002 globally, and in Africa in particular, you find that breast cancer is the leading cancer that is found among women, 29%, followed by cervical cancer. And when you narrow this down to Zambia, you find that the leading cancer that is there is cervical cancer, accounting for 41.1% of all cancers that we have amongst females. A very interesting statistic was given last year in January around this very period of time, where we're looking at the mortality when it comes to cancer in Zambia. And we had recorded close to over 9,000 mortalities of cancer deaths. That's among male and females. And if you look at these numbers when broken down, it was attributed that cervical cancer accounted to about 1/3 of these particular mortalities. We're talking close to 3,000 plus of all the people that died in our country were due to cervical cancer. And I think it just shows us just how high this particular burden is. So Zambia has the third highest burden of cervical cancer in the world, which is extremely high. And if you look at the number of women that have got the probability of getting cervical cancer, you find that the incidence rate is about 65 per 100,000, with a mortality that stands about 43.4 per 100,000. So, with cervical cancer in particular, you find that the mortality is as close to 40 to 50% amongst the people that actually get the diagnosis of cervical cancer. It accounts for 23% of all new cancer deaths. And if you look at the peak in which you see the diagnosis of this disease, it's around the ages of 40 to 49. These rates are much higher among the HIV infected women. But what we are beginning to see right now is that the trend is changing. Why? Because with the advent of antiretroviral drugs, you find that the population that is HIV infected has seen an improvement in their immune response. And with the improvement in one's immunity, one is able to fight the virus, which is the human papilloma virus, the one that leads to cervical cancer. Therefore, what we're finding is that even in the non-HIV infected population, the rates of cervical cancer are actually rising. So, what causes cervical cancer? The human papilloma virus is the biggest cause of cervical cancer. It is the primary cause of cervical cancer. And if you look at the human papilloma virus, it is the most commonly transmitted, sexually transmitted virus. So, not even HIV, not even syphilis, not even gonorrhea, the human papilloma virus is the one that is commonly transmitted. One might ask, why is it that if it's so commonly transmitted, people don't have any symptoms? And the answer is very simple. Sometimes I actually say, like God is good. Why? Because it's the most commonly transmitted viral or sexually transmitted infection, you find that the body is able to clear it through its own immune system. 80% of these infections are cleared out of your system within an 18-month period, which is really, really good. However, when do you get these cancer changes? So these cancer changes begin to happen, number one, if an individual is getting repeated infections of the human papilloma virus. If an individual's immune system is not well enough to clear this particular infection, you find that that's when it infects the cells, starts to cause changes to the cells, starts to dysregulate the way the cells get to die, and therefore they start to overgrow, and it leads to cervical cancer. Because cervical cancer, the primary causative bacteria or virus is the human papilloma virus. What you get to have is that wherever the virus goes, it has the ability to cause cancerous changes. And if you look at the image on the right of your screen, you find that infection with HPV can actually cause oral cancer, penile cancer, vulvar cancer, anal cancer, vaginal cancer, and cervical cancer. So wherever the virus can go, there is a risk of one developing cancer in that particular area. So with the HPV, there are a lot of types of HPV. Some of the types are what we call low risks, and these are some that actually cause genital warts. And some types are high risk, and these are the ones that actually cause cervical cancer. So you find that HPV 16 and 18 are the most common ones that actually cause cervical cancer, accounting for about 70% of all cases. So, what is the lifetime risk of one getting an HPV infection? We know that it's a very common and the most common sexually transmitted infection. So, it means once someone becomes sexually active, they've got a 70 to 80% lifetime risk at one point in time of contracting this HPV. But just like I earlier mentioned, your immune system has got the ability to get rid of this disease. The next image is a bit graphic, and I apologize for that, but it is important for learning purposes. So when it comes to the middle image, those are what you call genital warts. And these are the ones that come from HPV 6 and 11 in particular. And on the sides, those are what you call sort of suspicious for cancer lesions that are found on the cervix. And if you look at just the way the images look, the ones on the far right, I'll skip them, please, in case people are getting disturbed. You find that because of the layer of the cervix has been eaten up by the particular infection that is going on, you find that these patients who develop this cervical cancer begin to experience pain during intercourse. They begin to experience bleeding that might not be associated with their menses. They begin to experience bleeding after sexual intercourse. Why? Because the cervix becomes this raw piece of material that can easily be injured and bleeding can happen. What are the risk factors that one can have in order for them to develop cervical cancer? Number one is early marriages. When we talk about early marriages, we're talking about young girls whose bodies have not fully matured. And because of the trauma that is sometimes associated with sex, you find that this predisposes them to repeated HPV infections. Multiple sexual partners, this is a sexually transmitted disease, and therefore, if one has an other STI, such as chlamydia and gonorrhea, just because it weakens the skin surfaces, you find that one would be more prone to developing this HPV infection, which leads to cervical cancer. Early sexual activities, poor vaginal hygiene, and poor vaginal practices, such as douching, where women start to insert things into their vaginal canal so that they can wash out, insertion of unprescribed medication. I've seen a lot of things on the internet where women are actually inserting metronidazole in there so that they can keep the area warm or hot for their partner. So you find that they are depriving themselves of the natural lubrication that is in that area. And as they deprive themselves of that lubrication, it leads to injuries to the cervix, injuries to the vaginal canal. A weakened immune system, multiple pregnancies. Why? Because multiple deliveries, delivery itself, it is a traumatic experience where injuries can happen to the cervix. And through these injured points, you find that infections with the HPV can actually happen. Smoking, which lowers one's immune system, can also be a contributing factor. What are the signs and symptoms of cervical cancer or precancer lesions? With HPV infection, unfortunately, there are no signs or symptoms that one might experience. And that is why screening is extremely important. Cervical cancer screening remains key. So, with early detection of HPV infection, one would be able to know that, okay, I'm having a high risk infection, or I have certain changes on my cervix that require immediate medical attention. So HPV infection unfortunately has no symptoms. So screening remains absolutely cardinal. And in the precancer stage, where you find that there are just cellular changes that are happening, as well, this is an asymptomatic, no sign, no symptoms that an individual is going to experience. And again, screening remains absolutely important. When one starts experiencing these common signs that come with cervical cancer, that's when the worry actually happens. Why? Because it means the disease is advanced, that it has affected your whole cervix, and that's why bleeding is there. That's why pain during intercourse is there, because it's also maybe affecting your vaginal canal. When you start experiencing lower abdominal pain, difficulties in urination, you start feeling certain masses, you find that we're talking about an advancement of the disease process. And what we are trying to prevent is from one experiencing these particular symptoms. So, screening 110% remains the most important thing that an individual can do when it comes to cervical cancer. When can you begin screening? According to the WHO, it's advisable that women above the age of 25 go for screening. And with screening, there are a lot of methods that are actually available. Most commonly in our health facilities, we've got what we call VIA, which is visual inspection with acetic acid. And with this VIA, a woman is placed in a comfortable position. The provider who's there gets to speak to her about the process. I must say, from my point of view, and even just having spoken to so many women, the most uncomfortable part of it is when a speculum is being inserted. A speculum is this metal object that we use in the field of obstetrics and gynecology to go into the vaginal canal so that we're able to clearly visualize your cervix. It might be cold at times, and therefore lubrication can be placed on it to allow for smoother placement. And that's the part where it might be a bit uncomfortable. However, the VIA process is quite a short process, as it usually lasts about 5 minutes. Then you find that vinegar is actually placed on the cervix for about 2 to 3 minutes, after which, if there are any cells that are abnormal or have undergone changes that have happened due to this HPV infection, you find that they're going to have this uptake of this vinegar. They'll be sort of dehydrated and they'll appear white in nature. And these are the areas that we get to concentrate on. So once you do your VIA screening, treatment can also be offered at that particular time. In terms of treatment that is being offered at that particular time, this involves either burning out the area that has got the infection or cutting out the area depending on the size that is there of the changes that we've seen. If it comes out negative, well and good, you'll be advised to come back after another 3 years for another screening. There are other high performance screening tests that are available, such as pap smear, and also when it comes to HPV testing itself. So with HPV testing, what one is testing is for the high risk viruses or the variants of the HPV that can actually lead to cervical cancer. And this is 16 and 18, as we had earlier mentioned. So with the screening, there is what we also call primary prevention. And this is available to young girls and boys in particular when we talk about the HPV vaccination. Remember, human papillomavirus is the one that actually causes you to develop cervical cancer. And there is a vaccination that is readily available in Zambia, in most health facilities, that you can give to young girls between the ages of 9 to 14. I always say, let the next generation suffer from something else. Let them deal with another problem, not the problems that we have been dealing with. A generation once suffered from HIV. They had challenges. We lost parents, we lost grandparents, we lost uncles and aunties. And you find that right now, antiretroviral drugs are readily available. And it is our duty to get tested. And if we do test positive, it's our duty to start treatment. Right now, we're suffering from a scourge of cervical cancer among the women. And what we're saying is that there is a vaccination that is readily available for young girls before they start having sexual intercourse that can be given to them. So, mothers, fathers, aunties out there, brothers, sisters, encourage the young girls to actually get this vaccination. So, with primary prevention, we're talking about things that one can do that can prevent them from getting the HPV infection. So, delayed onset of sexual intercourse, limiting the number of sexual partners, using barrier method. I always say the condom is the only contraception out there that is available to help protect you from sexually transmitted diseases. One needs to quit smoking and lead a very healthy lifestyle. Secondary prevention is the screening that we're talking about in terms of the VIA, in terms of the HPV test. The goodness with an HPV test, it's a self-test. One can do it on themselves. And then also pap smear. Pap smear is simply the same procedures as VIA screening, but a brush is taken from inside your cervix and around the cervix. And this sample is sent to a pathologist who is a doctor who looks at cells, and they'll be able to look at your cells to see whether there are any changes that are suggestive of HPV infection. When it comes to diagnosis, How do we get to diagnose cervical cancer? Any cancer is, number one, diagnosed by what we call a biopsy. And a biopsy simply means you get tissues of that particular cervix, you send it to a pathologist who looks at them and determines that this tissue looks extremely abnormal and the changes that I'm seeing are of a cancerous nature. How do you obtain this biopsy? Sometimes it comes through the treatment when one is undergoing the VIA screening and they find that there's a lot of changes that have happened. They cut out that particular area, they send it to the lab, and the lab pathologist says, okay, these changes are of a cancerous nature. So screening is very important. The clinical history that you present, if there's history of abnormal bleeding, pain during intercourse, you find that all of that will point out to a disease process. A physical examination can also tell, like I showed you the earlier images that could have been disturbing. It's important to look and see, okay, how does the cervix actually look like? And when you see there are these changes that have happened to the cervix that are quite obvious, that's when you know, okay, there's a problem that is going on there. And just among the clinical symptoms, you find that because there's an infection, there's an abnormal growth of the cells that begin to happen. You find that the cells also outgrow their blood supply and they start to die off. And like anything that dies off, it starts releasing this water, which is extremely foul smelling. It smells very bad, like something is rotten. There's this watery discharge that starts coming out of the woman. And it is at that point when people are extremely worried because those are symptoms that are highly suggestive of cancerous changes. Treatment is at different levels. So with treatment, you find that if it's precancerous, you find that burning can be done to an area of the cervix that has shown these particular changes. Or if it's a large area, it can be cut out altogether. Or if we find that it is still just confined to the cervix, operative management, such as a hysterectomy, where your uterus is removed completely together with the cervix, can be done. Radiation therapy is one that can be done as well. And this is something that is happening at the Cancer Diseases Hospital. And chemotherapy, where chemicals are introduced into your bloodstream to kill these abnormal cells that are growing at such a rapid rate. So if you look at radiation and chemotherapy, you find that this affects other cells as well, in as much as it can be targeted. So you find that that's when a lot of people experience severe side effects when it comes to the treatment. They experience weight loss, hair loss, they have a loss of appetite, persistent nausea, and vomiting. And what we're trying to say, even as we commemorate Cervical Cancer Awareness Month, is that early screening is extremely important. Preventive measures are extremely important. And for our young girls, the next generation, vaccination is absolutely key. So go for routine screening in order to reduce your risk of cervical cancer. You can do a pap smear, HPV testing. You can even go and do a VIA. It is extremely important that you get screened and have this screening every 3 to 5 years, depending on what the findings of your results were. Practicing a healthy lifestyle is extremely important. Healthy diet, exercise, quitting smoking, that is extremely important. And safe sex practices cannot be overemphasized. When it comes to vaccination, vaccination is available for the younger girls, and it is important that we actually get them vaccinated. So, a few common myths that surround cervical cancer and HPV infection is that HPV vaccination is not safe for children. That is an absolute myth. In the Western world, you find that vaccination has been going on for close to 20 years, and it's important that people get their children vaccinated. HPV can only come through penetrative sex. That is a lie. Remember, this is a virus, so therefore it can be transmitted through other forms of sexual encounters. So, cervical cancer is only for the HIV positive population. That's a big lie. Even the HIV negative population are still at risk of developing cervical cancer. Cervical cancer is the disease of the poor, another big lie. It affects women of all social economic statuses, equally. Remember, it is about the risks that lead one to get cervical cancer. Multiple sexual partners, that can be just about anybody. A person with only one sexual partner does not need to go for cervical cancer screening. That is an absolute lie. Every woman who is sexually active, regardless of whether she's monogamous or not, requires that they go for cervical cancer screening a minimum every 3 years until the age of 65. Smoking does not cause cervical cancer. Smoking causes injuries to the linings of your cell, and because of that injuries, it allows for the HPV, the virus that causes cervical cancer, to infiltrate that area and cause changes. If you have been vaccinated, you don't need cervical cancer screening. That is a huge lie. Despite us vaccinating our young girls, it is still extremely important that they still go for cervical cancer screening. Remember, with vaccination, a level of protection is being given, but that does not mean you need to constantly expose yourself to the virus that actually causes these changes. And finally, cervical cancer cannot be cured. That's a huge lie. When caught in its early stages, whilst you're confined to the cervix, you find that the cure can be 100%. Even with stages 2, where there's a bit of advancement, you find that the 5-year lifetime survival is over 90%. So the most important thing is, number one, preventive measures. Number two, get screened. And if you find that any changes at all, get that treatment as quickly as possible. So this is the end of my presentation. This year, the focus is on HPV vaccination and the importance of screening. So I encourage each and every one of us to speak to somebody about this and to start with ourselves when it comes to screening. That was the end of my presentation. I'll now open it up to some questions that individuals might have so that we can just tackle them a bit. This was just a short presentation where we talk about cervical cancer. Cervical cancer is the number one cancer in Zambia. It is the number one cancer that leads to mortalities. In 2024, we lost over 3,000 women to cervical cancer. So it is absolutely important that women get screened. Us as men, we speak to our partners, our sisters, our mothers to get screened. It is very important. And even us as men, we can play our role by being monogamous, number one. Circumcision is very helpful in preventing of this cancer spread, and safe sex practices are extremely important. So if there are any questions, you can touch them out in the chat box. Is there a harm to doing screening annually? There is no harm to doing screening annually. However, if one screening has been done with a high performance screening test, such as a pap smear or even the HPV itself, and we understand that the body's immune system is able to clear out this virus within an 18 months period, it is not necessary. However, if somebody is under a high risk, number one, they're married to individuals that are promiscuous, if I can put it that way, individuals that travel a lot, or they're in a high risk business, such as prostitution, you find that it is cardinal that you get screened as often as possible. There's another question about how does inserting herbs and pearls in the vagina affect you in line with cervical cancer? Thank you for that very important question. So you find that when one is inserting items within their vaginal canal, first of all, let me start with this. The vagina knows how to keep itself clean. I think that is the most important thing. Remember, even just when it comes to these vaginal washes, they are all for external use only. Why? Because the vagina has got its own way of maintaining that area so that there is no bacteria that enters in that area. And even as it's got this cleansing mechanism, any insertion or tempering of that particular area gets to distort the normal flora that is within your vagina. And once the normal flora is disturbed, you find that there is an increase of harmful bacteria that can go in that particular area. And with this increase of harmful bacteria, injuries can begin to happen to your cervix that may make you more prone to receive this HPV infection in that particular area. So please do not insert anything within your vaginal area that is not medically prescribed. Let's avoid washing in those areas. Let's avoid trying to make it warm for somebody. Why? Because we are disturbing the normal flora in that particular area. Oscar Michelo says, very insightful presentation and excellent. Thank you, Mr. Oscar. Charity says, thank you, Womb Care. You're welcome. Does overuse or abuse of antibiotics affect your risk from suffering from cervical cancer? Thank you for that question, Dr. Keleti. One thing about antibiotic use is that antibiotics, when not medically indicated, and we self-prescribe quite a lot. And this is what has led to one of our biggest burdens right now, which is what we're calling antimicrobial resistance. And in antimicrobial resistance, what is happening is that bacteria is becoming resistant to antibiotics. So when it comes to abuse of antibiotics, you find that these antibiotics will also kill the normal flora that is within your vaginal canal. And once that normal flora, normal bacteria has been killed, there is an overgrowth of other harmful bacteria. And that is why women, after using antibiotics for prolonged periods of time, you find that they end up developing a yeast infection. Why? Because they've killed the normal bacteria that is there, the lactobacillus, and therefore it leads to this overgrowth of bad bacteria. And the overgrowth of bad bacteria might make an individual more prone to having infections of the HPV. So it's important to use antibiotics only when medically prescribed and for the duration that they've been prescribed for without skipping any doses. Can male partner acquire HPV infection during intercourse? The answer is yes. Remember, the human papilloma virus is sexually transmitted. So it depends in the relationship on who has this particular infection. So if the female has got the infection and it's persistent in them, their male partner can actually develop it. And you find that the HPV on the male side can actually cause penile cancer. The HPV on the male side can actually cause genital warts. So definitely this can be passed on. Oscar Michelo said, missed the first part. What are the early signs, warnings that most people get to ignore? I'll tap into a case that I had to answer this particular question. So this woman came through to the hospital. She was about maybe 37, 38 years old. She came with her husband, very, very caring man. And the one thing that they were complaining about is that she has been having bleeding after intercourse. And every time they try to engage in their marital rights, you find that she used to bleed. When we did just an evaluation and an examination of her, we found that the cervix had been eaten up and part of the vagina was eaten up. Clinically, she had almost a stage 3 cervical cancer. And this is something that did not just happen abruptly, but was happening over a consistent time. So things such as pain during intercourse, things such as bleeding during bleeding after intercourse, or even just in between your menses, where somebody just keeps on losing weight, being tired, they're just not being well. These are things that people get to ignore. And it is important, if you have any of those episodes, you come through the health facility for screening so that we can understand. There's another question that how soon after childbirth or pregnancy can one go for screening? So you find that during this period of time, what is advisable is for you to wait for the postpartum period, which is about 6 weeks. Why? Because at that point in time, your hormones have settled down in your system. The highly sort of increased blood flow that was going everywhere to your uterus has sort of normalized. And it's at that point in time when you need to go for your screening. For women that are pregnant, but you as a clinician are highly suspicious, a woman is suspicious herself, pregnancy should not stop you from going for screening. Remember, cancer can lead to death, and it's important that it's detected as soon as possible. Simon Peter says, thank you, Dr. Msova. If a man has intercourse with a lady who has cervical cancer, is there any effect on the man? Does oral sex cause or lead to any cervical cancer? How can we help men? So, to answer your question, if somebody has sex with somebody that has cervical cancer, you find that with cervical cancer, there's so much injury that has happened to the cervix. And that was the image that I had shown earlier on. And because of this injury, you find that there is an infection of the human papillomavirus. So the man is at risk of getting infected with the human papillomavirus. That's number one. And towards the woman, there's a risk of pain and bleeding that might happen. With oral sex, you find that it can mainly cause even throat cancer in itself. Why? Because as long as there is an infection of the human papillomavirus, this virus can move to every area or area where it can spread to. If you saw the graph that I showed at the beginning, it can cause oral cancer, throat cancer. It can cause rectal cancer if it goes into that area, and that is something that we've seen in the gay population. It can cause cancer of the vulva area. The labias can be affected as long as you find that there is that infection of HPV. So, what can we do as men? Number one, safe sex practice. We can't run away from that. We need to avoid promiscuity. That is something that is very important. And it is important that we also undergo circumcision. Why? Because with circumcision, the areas that easily get injured, and that is a man's foreskin during sexual intercourse, is taken away. And you find that the glands is much more less receptive to infections than the foreskin. So that is something that is very important for us to do. Mr. Kelvin says, this is very insightful. Thank you, Womb Care. You're very much welcome. Simon says, my mom passed away from this 2 years ago. I know how dreadful cervical cancer is. My sincerest condolences to you, Simon, on the loss of your mom. And you're absolutely right. Cervical cancer is something that is extremely dreadful. It is something that we need to take a strong fight towards. And as men, we need to also take a leading role to encourage our partners, to encourage our sisters, to encourage our mothers, to help our daughters, our nieces in this particular area. It is very important. Wonderful presentation. Just a quick question. Why is 25 the recommended age for screening, not earlier? With 25, I'm sure it was chosen as an arbitrary age. Why? Because at that point in time, we assume individuals are now fully sexually active. They've reached their reproductive years and they're pushing. But you're absolutely right. Earlier can also be done. Remember, the risks are early marriages, early sexual encounters, multiple sexual partners. And this is something that we are currently seeing from even the young generation that we have. So it means if somebody has been exposed to sexual intercourse at an early age, it means you can also begin screening at an early age because we're getting cases where young people are actually dying. The presentation said peak age is between 40 and 45, but we have seen cases of cervical cancer as young as 30, as young as women in their 20s. So this is not an age related, but it involves these multiple risks, multiple infections that an individual can have. So if one is at high risk, please let's get screening as soon as possible. Oscar Michel says, thank you, Doc. You're most welcome. Namonjo says, great presentation. Thanks, Doc. You're most welcome. Emily says, I missed the presentation. My daughter is 12 years old. Is she late for the vaccination? No, your daughter is not late for the vaccination. Please get her vaccinated. Almost every health facility in Zambia now has the HPV vaccination, and it is absolutely free. Let's not lag behind in areas that the Western world has been well advanced. So let's get that vaccination for the young girls. So with vaccination, you're talking between 9 and up to 15 years. And if somebody hasn't been exposed, they can even go up to 25 years in terms of them getting the vaccines. That is something that is happening in the Western world. Simon Peter says, I saw a disturbing statistic earlier in your presentation. Zambia is ranked third in the world. Yes, it is. It is ranked third when it comes to cases of cervical cancer. Something even more disturbing is that you're looking at 1/3 of all cancer related deaths are due to cervical cancer. The reason why we're having such high numbers is number one, we've got cultural practices at play. We can't run away from that. The issue of HIV and immunocompromisation at one point in time was very high. We can't run away from that. When we talk about our lifestyle, the way that we get to practice as well, when you talk about in terms of promiscuity, that also plays a role. When we talk about lack of screening in particular, that is extremely worrisome. And remember, as a country, we've got one cancer disease hospital. It means all the burden of cancer for the 23 million population is just funneled to one place. So that is also a challenge as well. So it is multifactorial as to why we've got such a very high burden when it comes to cervical cancer. It's multifactorial why we have so many people that when they are diagnosed, their mortality is very high or they are diagnosed quite late. So it is our duty, and that's the part that we are trying to speak to as Womb Care Clinic to say, how do we help the population get to know? And we believe that through knowledge, people will be able to understand what is going on with their lives and they'll be able to seek help much, much earlier. Mercy says, well explained. Thanks, Womb Care. You're most welcome. Emily says, thanks, Doc. You're most welcome. Charity asks, how much do cultural practices, initiations to adulthood contribute? If you look at the idea of early sexual encounters, where you're talking about a young girl who is 12 years old just because she has her menses to say her body is ready for sexual encounters, if I can put it that way, and then she begins to engage, you find that that area of the cervix is still quite immature. There are still changes that are happening there, and it becomes easily injured during encounters. And those are some of the things that predispose young girls to getting these particular infections. Then you also talk about idea of douching, inserting herbal medications, all these pearls that women are inserting to make themselves much more appealing, quote unquote. That is something that also contributes. So we do have a lot to do as a culture, as a nation, as individuals, but I believe it starts with knowledge sharing. And through this knowledge sharing, you find that people will feel much better and much more prepared. So I do not see any more questions in the chat box or comments. This is a recorded session. We will be able to upload it to our YouTube channel. We will be able to share it with you, but you can take time to listen, share it with a loved one, and help them do better or feel better. And please, as women, as mothers, let us get screened. It is very, very important. Um, thank you very much to everybody that logged on. Remember, January, cervical cancer awareness. Please, let's get screened. Let's not shy away from it. Let's not run away from it. On behalf of Womb Care Clinic, we are extremely grateful. And please do stay tuned. Womb Care Clinic, through its Scars of Womanhood, will be hosting a women's conference on the 14th of March under Women's Month. It's a one-day conference where we'll bring a lot of powerful women to come and share their stories. So it is very important that you do look out from our pages and see how you can log in and just come and interact with other women. Wishing you all a very lovely week and thank you very much.